In July 2026, the state government launched a massive new health initiative from Varanasi designed specifically for its education workforce. Led by the Chief Minister, the State Department is now fully covering the 3,000 rupees annual premium for this policy. Your out-of-pocket cost to activate it is zero. Basic Shiksha staff, including teachers, Shiksha Mitras, Anudashaks, and Rasoyas, are entitled to 5 lakhs in cashless health cover for their families. To access this benefit, you need to navigate the state's online portal and understand the exact operational rules for hospital admission. We are going to walk through both, step by step. Before we open a browser, gather these 3 items: your Aadhaar card, the active linked mobile phone, and official IDs for your family. Preparing these materials in advance allows you to complete the online application in about 10 minutes, securing your family's coverage without technical delays. First, let's clear up the most common roadblock. Many educators confuse this new health cover with the Ayushman Bharat scheme. They are separate programs. Ayushman Bharat, or PMJY, operates as a safety net for vulnerable citizens. As a government employee, your primary coverage is the exclusive Mukhyamantri Cashless Chikitsa Yojna. If you or your dependents are already covered under PMJY, you must choose only one scheme to use. The system will prevent you from claiming double benefits. Now, open your browser and type the portal URL cmttcs.upsdc.gov.in. On the homepage, click the Apply for Shiksha Cashless Chikitsa Card button. You'll be prompted to enter your Aadhaar-linked mobile number and CAPTCHA. Hit Submit and enter the OTP to log in. Logging into this specific portal with the correct credentials ensures your application is instantly routed to the basic Shiksha department, bypassing generic application queues. Inside the application, you'll start by filling out your professional assignment details. This requires inputting your assigned district, block, and your present post. Next, input your personal information. Be highly precise with your date of birth and expected retirement date, as these fields verify your active service status. Third, add your eligible dependent family members. Ensure their names and relationships match their official IDs exactly. Finally, upload your required verification documents. Review your entries one last time and hit Submit to send your file to the department. If you realize you made a typo with your Aadhaar or mobile number, a dedicated correction form is available on the portal to amend errors. After verification, log back into the portal. You will now see an option to download your active Mukhyamantri Shiksha Health Card. Accurate data entry prevents your application from being flagged for avoidable typos, allowing the department to focus exclusively on verifying your service status. When a medical crisis strikes, arriving at an impaneled hospital can be overwhelming. You need to bypass the standard intake procedures. Do not stand in the regular billing line. Walk directly to the hospital's designated Ayushman Mitra or cashless help desk. Hand the desk staff your downloaded health card and your Aadhaar. The hospital will use these to request online authorization for your specific treatment package. Once authorized, everything is free: registration, general ward, tests, surgical tools, and post-discharge medication. If a hospital demands a cash deposit or equipment charges, refuse. That violates the state's agreement. There is one allowed exception. The standard package covers a general ward bed. If you choose to upgrade to a private or semi-private room for personal comfort, you must pay the out-of-pocket price difference. Knowing these operational boundaries ensures you don't pay out-of-pocket for services the government has already pre-purchased on your behalf. You are now ready to use the portal and secure 5 lakh rupees in annual cashless medical coverage at private and paneled hospitals. And if you utilize a government hospital, your treatment coverage has no upper financial limit. To guarantee hospitals honor this system, the state operates a 24/7 toll-free grievance helpline, 14555. Save 1455 in your phone contacts right now. If a facility denies you cashless service or demands illegal fees, call this number immediately to register a complaint. Share this guide with your colleagues to ensure the entire basic Shiksha community activates their rightful healthcare safety net.